Welcome to OET Writing for Doctors. The writing test is 45 minutes long, and the first 5 minutes are for you to read the case study. You're not allowed to mark the case study in any way. You must just read it, and then you get 40 minutes to write it. It's probably a good idea to only spend 35 or 7 minutes writing and leave yourself a couple of minutes to check your grammar at the end. So what do you have to do? You have to make sure that your letter has good, correct formal formatting. This means you leave a clear blank line between paragraphs, the letter is dated, and the content of the letter is relevant, concise, and accurate. So make sure, first of all, you write a date. You put a date on it, right? The date of the test normally, that is the date. And you write a short introduction. Now, the introduction is really, if you can incorporate in the introduction the name of the patient, and why the patient is being referred. And that's a very good introduction. Might only be 1 or 2 lines long. Then you start a new paragraph. Put a blank line between the paragraph, and then you outline the patient's past and medical and current medical history. What's wrong with this patient? Do not include anything that is not relevant. Right, so you might include things like social details. The patient lives alone. That might have an impact on the care of the patient immediately after being discharged from hospital. You might be a doctor writing to the director of nursing at a aged care place, and so it's important that he or she knows that this particular patient does need to be using a walking frame, things like that. All right, so here we go again. This is all the criteria. Your letter has to have good grammar and spelling. You have to complete all the given tasks in the writing task. Your letter has to be logical. It's got a good flow. It's got cohesion, they call this, and you don't repeat information. Keep it formal. Don't say dear Bob, dear Joe. It's dear Dr. Jones, dear Mrs. Jones, and so on. Dear Registrar, dear Director of Nursing. Make sure it's got the correct format, right? Dated, the separate paragraphs, it's got a reference line, and it's got a suitable finishing paragraph, something like, if you need any further information, please do not hesitate to contact me. That's always a good thing. Or please provide a second opinion and advise me of the outcome, something like that. Minimal abbreviations. All right, so you are allowed to use BP for blood pressure and PR for pulse rate, and other sort of things, particularly with medications. So it might be something that has got its 10 milligram strength, and this is going to be given twice a day. So you can write B.D. That's fine. All right, you can do that. All right. This is an important one. This is a new criteria, the tone of your letter. So they want you to make sure that you are writing in a way which is understandable by the recipient. So if your patient is a young child and you're writing to the parents of the child, these parents may not understand health medical jargon. Now you can put in your medical jargon, right? You can include it, but then in brackets after the particular term, explain what that means. All right, put that in brackets. So that would be okay. here's a case study, all right? Bernard King. And there's Bernard's address. He lives on a property called Derry Bar, and it's in Jervois Road, Wellington, South Australia. Now, I've brought the writing task up to the start here because that's really the first thing you must do when you're looking at case studies. You go straight to the writing task. Have a look at this, right? You want to use the information in the case notes and write a letter of referral to this orthopaedic surgeon, this person here, right? And in your letter, you've got to request that he assess and take over the ongoing management of this patient. Make sure you do that. So the case study goes like this. Back in March 2019, this 77-year-old retired farmer came to see the doctor. He'd had a 2-month history of severe pain in the right hip and knee, and he'd been having trouble with his right hip for 5 years. He could bear his weight, but the pain was increasing during the day, and when he took Panadol, he didn't get any relief from the pain. So you examined him and you noticed that he walks with a limp. And he's actually got less internal rotation and flexion on the right hip. His right knee's normal. So you believe he's got osteoarthritis in the right hip, and there's been degenerative changes, and you put him onto a course of indomethacin tablets, 50 milligrams, 3 times a day. A couple of months later, in May, he had a flare-up again of this right hip pain, and he'd actually stopped taking the indomethacin on his own accord 6 weeks previously, and now he's got decreased range of movement in the right hip, and he's unable to bear weight on it. So you believe the osteo is getting worse, and you've recommenced him back on these tablets. 1 month later, or maybe 2 weeks later, he was complaining of upset tummy, dyspepsia, and so on. The hip is not getting any better. Right, he changed his medication to this stuff here, Tilcoffel, 25 milligrams, 2 tablets in the morning. And August comes along, a little improvement, and the dyspepsia is getting better, but there's a decreasing range of movement in the right hip. He's definitely got osteoarthritis, which is not responding to the anti-inflammatory medication. So your plan is to refer him to an orthopaedic surgeon for assessment and advice. And he might be needing a hip replacement. So you've got to make sure you do all this when you write the letter, right? That's a little reminder. So this case study has actually been attempted by a previous candidate. So we're going to have a look now. Right? Thank you for seeing the above named patient, a retired farmer who is suffering from osteoarthritis, refractory to the anti-inflammatory medication. On 13 September, Mr. King presented with a 5-year history of discomfort in his right hip. Moreover, he developed severe right hip and knee pain, aggravated with exertion and not relieved with Panadol over the last 2 months. His vitals, not vistals, his vitals were stable, and his physical examination showed limping, decreased internal rotation and flexion of the right hip, and normal right knee. His right knee x-ray was normal, while his right hip x-ray revealed degenerative changes consistent with osteoarthritis. A course of something, I haven't quite copied that. On November 28, 2018, right hip osteoarthritis exacerbation was established as Mr. King was non-compliant with his medication. Recommencing indomethacin was instituted. You don't need this nevertheless. Just 2 days later, Mr. King was diagnosed with that, and hence Mylanta was added, replaced by Tilcoffel. It's worth mentioning Mr. King's hip condition remained unchanged. Not bad, not too bad. So that's a bit of a guide as to how you could write that letter. Here's another case study, second case study. This one's about Corinna Martinez, and she is a retired judge. She's got 2 adult children. Again, the writing task is brought up to the start. Write a letter of referral to Dr. John Jones, ophthalmologist, level 18, Collins Tower. 35. So when you do this address, okay, this is line 1. Ophthalmologist would be line 2. Level 18 is line 3. Collins Tower is line 4. 35 Collins Street would be on the 5th line. And Melbourne, 3000 would be on the 6th line. Right? Right. 18th of March, suffered from headaches past 6 weeks, felt well before then, never suffered bad headaches previously. She's got a pain, a dull ache, a nagging pain, it's bilateral frontal headaches, and they're just all the time, they're constant. So she's going to start taking Nurofen 4 times a day. Now she's lost 3 kilos in the last month, this is 1 month later. Headaches are getting worse. Patient scores 9 out of 10 on the pain level. It's affecting her work. She can't concentrate. She's tried various painkillers, no success. Is drinking more, 2 glasses of wine a day. Okay, so now you're going to put the Nurofen up to 6 times a day. Temporal artery biopsy on the next visit is planned. Oh, there's the plan. So the patient is told to diarise headache attacks and advised to stop drinking alcohol. The following month, the patient complains of pain when chewing food or brushing teeth. Also gets pain when combing her hair. She can't sleep at night. Pain's too bad, too severe. She's got scalp tenderness when she wakes up. This here was the ESR. That, look down the bottom of the page, that's what that means. That. Well, you diagnose giant cell arteritis and you plan to commence her on steroids and bone prophylaxis immediately and refer her to Dr. Jones because the patient has requested a second opinion. So here's your writing task. So candidate wrote, thank you for seeing the above named patient, a married judge. I think that should actually be a retired judge. I think that would have been better. Hang on, give yourself another pen here. It's probably a little bit easier. No. Wait a minute. Now I've done it. A retired judge. Okay. 1 month later, despite taking the medication, Mrs. Martinez's, that's correct, headaches were getting worse and were affecting her daily life. Mild weight loss of 3 kilos, along with a high level of blood pressure, 140/90, were noted. She stated that she had been drinking more. Hence, I advised her to cease drinking and to diarise her headache attacks. Additionally, Nurofen was augmented and obtaining a temporal arterial biopsy during the next visit was discussed. That's an odd way of putting it, but it's not wrong. Okay. Today, chewing food, brushing teeth and combing her hair aggravated Mrs. Martinez's headaches. Scalp tenderness and insomnia were reported. She was hypertensive and had a high level of ESR of 142 millimoles per litre, not sure. Therefore, I commenced on a prophylactic dose of steroid immediately. Oh, there we are. Now, you're invited to write both of these case studies, write letters, and if you would like to, you can send them to me. Now, my email is info@oetworkshop.com. Right. So write the letter, send it to info@oetworkshop.com. I'll review your work and email it back to you. It's no charge, it's all part of this video. Good luck with any of it. And if you've got any questions at all, you can call me. Now, my mobile number is 0406 587 936. So you can just ring me and ask a question. Or there's a link on the website click on that to get to WhatsApp, send me a little message. So if you're doing this video and these 2 letters, it's not a problem, okay? We can sort out any little queries you've got, and the best way to learn is to make mistakes, okay? That's it. Good luck.